For more than 65 years, the University of Houston College of Pharmacy's alumni, faculty, and students have been at the forefront of providing exceptional patient care, discovering novel drugs and drug targets, and assessing health outcomes and policies. Our students, faculty, and alumni prove themselves year after year, winning awards, leadership positions, and research recognition at the national, regional, state, and local levels. They managed to achieve all of these accomplishments despite studying in cramped classrooms converted from old laboratory space or conducting experiments in laboratory designs that were phased out more than 20 years ago. Our UH College of Pharmacy is one of the pillars in Chancellor Couture's vision for the UH Health Initiative, which will transform how the University of Houston, and in many ways our academic peers, educate and train the next generation of healthcare professionals. What this new building will mean for our program, we'll be able to have research laboratories that were designed for current state-of-the-art pharmacy and drug discovery research, and our faculty will have laboratories that are not only adequately designed but provide adequate space for what they do. ACPE has been telling us that our facilities need to be enhanced and they are not adequate.
Being in this profession and in that area, working in labs and running the labs, I knew that this was a genuine need for the college. And I can understand to do a better research, you need good instrumentation. Without that, you can be nowhere.
There's many different types of learning techniques that are coming through, ways to teach students better and more innovatively that require the technology that is not available to us right now.
There's not a huge amount of pride, I would think, in terms of showing off where you work. Certainly pride in your work, but the ability to say, this is my place, this is our place. I think that is going to be really, really critical in terms of the way the faculty feels about what they do. And in terms of attracting top faculty.
First impressions are very, very important in a student's decision on which college of pharmacy to attend.
Building a better reputation will attract better students.
We're excited that now we'll have classrooms that were designed as state-of-the-art classrooms for the delivery of modern-day pharmacy education. We are also excited about our new pharmacy care laboratory. The students will be able to go in and have simulated patients. They'll be able to learn to work as a healthcare team that will provide opportunities for physicians and pharmacists and nurses to understand each other's roles in the delivery of healthcare.
It feels a little divided, especially because we look to our upperclassmen for a lot of advice and a lot of support.
With a college that is in one house, I really think that a building where we're all together and where we all can come together and we have all of our professors, our faculty can be meeting there, would really add that extra dimension to what the college already provides for us.
New compounding and IV facility will allow our students to learn and practice and have adequate hands-on experience in developing the latest compounded therapeutics for their patients, as well as sterile IV admixture procedures in a real-world environment.
They do point-of-care testing, they do patient counseling, they do MTM or medication therapy management. Every pharmacy does this. Within our new building, we will have the facilities to support the teaching of all of these types of activities. We teach them all of these skills, but with the new building, we will have the facilities to be able to take them into a community pharmacy and teach them the point-of-care testing that happens now in community pharmacy that didn't happen in the past. So our students will be able to learn the techniques and how to implement that into the workflow in a better way with the way that the practice of pharmacy is changing.
It's important that we develop a new innovative college to ensure that our students are continuing to be well prepared for the challenges ahead. And so having simulation centers like what's planned within the new building, having patient counseling center, having those resources so that students are exposed to what's necessary to provide the best care for patients is extremely important. And I think that's some of the more exciting pieces and components of what this new building is going to bring us.
They say an adult learner learns best if they hear it, read it, see it, and do it. And I think just having that little bit of extra practical experience before you go see your patient for the first time, it really gives a student and an individual that degree of confidence that I know I can do this. And when you walk into a room and you know that you can take care of that patient, make a difference in their lives clinically and with their health, it is so empowering. And I think that, you know, having that hands-on is just really going to take them to the next level.
As a future alumni, I want to come back and I want to see what has this college done? What are they providing for their students today? Wow, look at this awesome, you know, simulation room that they have. Isn't that cool that they can see what it's going to be like to be out there, to be in a clinic, to help as a pharmacist. And I think that those sorts of experiences earlier on in the education, in our 4 years of education, will really be powerful for the college, be powerful for our students as future pharmacists.
Yes, they've got a great name, and now I'm going to have these additional facilities, these excellent state-of-the-art facilities and access that I didn't have before.
We need to get these new buildings, get these new technologies so that we can keep up with the standard of practice.
We needed this building to take the next step. I mean, we're just not going to go anywhere without this building. The bar goes up significantly with a new, well-equipped building, without a doubt. At the very least, I'm going to feel more at ease and more comfortable that I can focus on just, you know, getting my messages to the students.
This new building will be a game changer for our college. This new building will go a long way to help our program maintain a great track record from a national accreditation standpoint. It will allow us to use some of the latest teaching technologies and approaches to ensure optimal teaching outcomes and produce the best pharmacists, not only in our country, but the world. This new building will allow us to reach even new heights that some may never have dreamed. We are going to be one of those programs that are going to be seen as a top-tier program from a research perspective. Students will be able to gain the knowledge and clinical application abilities to go forward and truly make huge impacts within their communities and see enhancements in the health and well-being of those communities thanks to these very talented pharmacists.
And as a future alumni, this new building creates not only a sense of pride for myself, but for the community. Now, one can argue that better facilities translate into a better skill set, and certainly that makes all the difference in the world in taking care of our patients. But this new building means so much more than giving back to the community. It means giving back to the future. It means making a stance that says quality matters.
You know, University of Houston has many things to boast about, and this new building will just be one more thing to show that everything that we're made of really is encompassed within this building.